Hi there, my name is Gerard Green. I'm a pelvic health physiotherapist. What I'm going to demonstrate is belly breathing or abdominal diaphragmatic breathing. And this is really good to induce some relaxation, some movement into that pelvic floor. So sometimes a good starting position is in lying, knees bent up, knees dropped out, feet on the ground bed, one hand in the sternum, one hand in the soft tummy, trying to get the tummy nice and soft. This is this is more difficult than it looks. It's definitely not easy. So what you're going to try and do is take a nice deep breath in, into the abdomen, feeling that hand really elevate. A couple of seconds and then out. Nice big abdominal belly breath in, feeling the hand elevate. And then out. When you then get into doing this, what you'll also feel is a little bit, probably a downward gentle stretch into that perineum. It's that soft area between the genitals in front, back passage behind. And what we're going to try and do is do belly breathing up to about 15 minutes. But we wouldn't do that at the start. I think initially do it for 5 minutes, maybe even once a day, then build it up to twice a day, then gradually get up to 10 minutes, then 15 minutes. But this is a lot, it's a lot more difficult than it looks. So breathing in, feel that hand lift up, a little bit of gentle downward perineal movement, and then out. The people we're trying to get to do this generally are our patients with maybe pelvic pain or abdominal pain or overactivity in those muscles, and they're the people who tend to have a lot of muscular tension anyways, sometimes but not always, a lot of stress anxiety. So those people tend to be a lot of apical breathers up here, and they tend to breathe from up here, so they co-contract everything. So for those people, and they're the people we want doing this, it's trying to take a nice breath in, really feeling that abdomen lift up, and also feeling that abdomen nice and soft and relaxed, rather than it being very tense. A progression of that is doing it maybe on the ground, but with the knees up to about 90 degrees, hips 90 degrees, knees 90 degrees, knees dropped out. So a good place to do this is, lying on the maybe bedroom floor, calves up in the bed, lying on the floor, legs up in maybe sofa or an armchair. So the legs have got to be fully supported. So the position I'm in is not really ideal. It's a bit too soft to support, but it's just to demonstrate to you what position you're in. So 90 degrees, dropped out, feeling that stretch in the perineum. And in this position, going to do the same, do some nice belly breath. So breathing into the tummy and then out. This position is really brilliant because you get a nice stretch in the adductor group, you get a nice stretch in the perineum, and you start to really get a nice stretch in those superficial pelvic floor muscles, the ischiocavernosus, bulbocavernosus, which tend to be really involved in a lot of that male pelvic pain and female pelvic pain, vulvodynia, hard flaccid. So those are really key muscle groups that we try and get in. So we really progress from doing it on the flat to in this position. And the same again, trying to build up about 10-15 minutes. So the difference I feel in this position, I can feel a lot more when I breathe in, into that perineum, into that kind of rectum, kind of around where that sling of muscle is around the rectum, that puborectalis. And it's a real bit of trial and error. If you feel, well, I'm getting more from doing it with the feet flat, that's okay. We're also going to then move into doing this. So you keep doing it in lying, because lying, everything's really relaxed. You get nice movement of that pelvic floor. But we don't spend most of our day lying down. So you've also got to do it in functional positions. So it's good to also do it in sitting. So we're just going to sit up. So let's say I'm sitting either in the car, or we're in COVID-19 at the minute, so we're all home working. So in sitting, I would sim again, do some of that nice belly breathing. So hand here, hand in the tummy, really breathing into that tummy. So big breath in, big breath out. Building up to doing that for a few minutes. When you're back with your co-workers, you probably won't be wanting to do this, or they'll think you've joined some type of cult or something. So you by the stage you're doing it in sitting, you'll have done it a lot anyway. So you can just do it without the hand. So you might be typing, you might be on the phone to someone, you might be driving. So you can just do that belly breathing, and you'll really feel that downward pressure. It's also really good when you've got good at the breathing, and perhaps your specialist pelvic health physiotherapist has asked you to do some reverse kegels. So a good position to do reverse kegels in is sitting, because gravity is helping you. So what I'm going to do is take a nice belly breath in. Nice belly breath in. And then as I'm breathing into the belly, soft belly, I'm applying a little bit of gentle downward pressure. Almost like I'm gently trying to push something out very gently through the back passage. So I'm taking a nice big belly breath in. At the same time, gently pressing down through the back passage, very gently, holding for about 2-3 seconds. So giving more of a sustained stretch down into that pelvic floor. But I only really want to do about 10 of those. I don't want to be doing too many of those. So it's good if you've been advised by your specialist pelvic health physiotherapist to do some reverse kegels. Good position to start is in sitting or in standing. So I'm going to take a nice breath in, big belly breath in. And at the same time, I'm going to gently press down, gentle pressure through the back passage. Hold for a couple of seconds and let go. Reverse kegels don't come easily. Men in particular find them difficult to do. Females also find them difficult to do. So it can take a week or so to really feel I've got that. So if you're doing the reverse kegels and you think, I'm not getting this, don't panic. Everyone feels the same. But generally, belly breathing first. Get confident with that. Get comfortable with that. Then add in some of the reverse kegels if you've been advised. There are also some other positions we like for the belly breathing and the reverse kegels. So if this plinth wasn't here, if I could magic it away, I would be standing with my back to the wall. And I could sink into the wall a little bit. So my back's to the wall. So I'm resting in the wall, so I could do them in standing. So I could do some belly breathing in standing. A couple of minutes. Or maybe that I'm standing. Probably aren't on the bus or train at the minute because we've been advised in the UK not to take public transport, but I might be standing in my kitchen or maybe preparing some food so I could do some belly breathing. Or I maybe I've taken a phone call at home and I'm feeling a little bit stressed because of that phone call and I can feel things tightening up, so I could then switch into doing some belly breathing and standing, some reverse kegels and standing. Another really nice position is doing it in a squat position. Better to do a squat over something, so that may be your sofa, maybe if you've got a big gym ball, your bed. So I'm going to squat down. I'll just face away from you for a minute. Feet apart, really supported, knees apart, really dropping into that hips and perineum. And I'm going to do some nice big belly breaths in and out. Big belly breath in. Really feeling that downward perineal movement. And I could also do some reverse kegels in this position. Some people like this position. The people who don't like that position, the people with stiff hips, maybe knee problems. But really, you've got to work out, well, I feel it's good in lying. I feel it's good in this position. I like it in sitting more. Some people do like the squatting position. And then another final position is like a yoga position, which is coming knees apart again, dropping back. And in this position, just doing some nice big belly breaths. And then also doing some reverse kegels. But we do those separately. So you tend to do much more of the belly breathing, little bit of reverse kegels. So thank you for listening, and have a go at it, and let us know how you get on. Thank you very much.